I'll tell you, right? I mean, I do wear them every day. So we got suction on here now?
It's right.
Oh, behind them. We got everything. I gotta work.
So you're responding? Are you?
I'm the lead.
You're the lead? Okay.
Yes, sir.
Have you been briefed about what we're going to do?
I know there's a scenario and there's a bunch of people watching me, and I'm supposed to do the best of my abilities, and
I wouldn't say a bunch of people watching you.
a handful.
Oh, wow. So yeah, exactly. If you want something, you can delegate it to your professional partner,
Okay.
but you will only, you need to do things to get things. So if
Right.
you want a blood pressure,
Some good
either
acting,
you or he
Yeah.
has to actually rep the blood pressure.
Where's the makeup?
Huh?
Tell me what the blood
Makeup,
pressure
right?
is, and then I will relay back to you what the actual, or Jim will relay back to you what the actual
Okay.
blood pressure is. There's no passive
Hands on.
information, so you can't say BSI is my scene safe. You have to
Right.
go in there and assess it, and if you see a scene safety issue, address it. Or if you see your partner, he's not intended to do malicious things, but if he does something that you're not comfortable with, you have to
Stop.
say,
You
no,
guys
this is
got-
what I actually asked of
You guys
you.
did
Okay.
yesterday?
And he may do the same to you. So the rules of engagement, we will only stop it unless we see an actual serious threat to the patient
Right.
or yourself or provider. And it will go 20 minutes regardless of how you perform.
Okay. Are we doing radio as well?
Yes.
So radio reports, patient contact, all that stuff?
Yep. You'll have to, at the end, give us a diagnosis.
Okay.
Before the end, you'll have to call the radio report to the hospital. And when you want to transport, he leaves the scene. He
Okay.
is not back there with you.
Will he tell me, will I have to, like if I say, we're going to transport now, let me know when we're 5 minutes out or something like that, will he tell me in order to give my hospital report? Or am I just going to kind of, when I have time to do it, do
When you
it?
have time to do it.
So there's no time limit from when I start transporting, it's like 10 minutes and you're there, get whatever done you can get done. It's just,
At one point in the scenario, you have to say, I'm calling the hospital, this is what I have.
okay.
I'll be there whenever. Okay.
Yeah, portable radio.
You see a transition?
It doesn't matter when you go in there. Actually, yeah, we will dispatch you.
Okay.
But
I'm on top.
For his report to the
Yep,
hospital,
okay, we
what
go.
happened,
All right.
right?
Oh, yeah, you make the
Do we have a unit number or are we just making that up, winging it?
1, 2, 3.
Sweet.
Any questions?
Am I running the radio or is he running it?
Nope. This is you. This is
Sweet. All right.
testing your ability to be a team leader, a team member, and to delegate directions.
All right. And am I actually hitting the button?
Yep. Just like you would on a real life patient call.
Okay. Can do. Ready? All I gotta do is stretchers backwards.
You get more in?
Yep.
We're live.
Yeah, it's in my pocket. Stretchers backwards. Where's the board? There it is.
I'll give you my dispatch information, I'll go hide in the room, and then you can come in.
Fantastic.
So medical anywhere responding for a 23-year-old male, shortness of breath, chest pain after an assault.
23 SOB. Chest pain after assault. Alrighty.
In apartment 3.
Apartment 3. Alright. Let's roll. Chest pain. Cardiac tamponade. Can we make it? EMS!
Come in.
Alright, sir, how you doing this morning?
All right.
Alright, we're Unit 103. My name's John. We'll go this way. My partner here is with me. We're going to be here to help you today. What's going on?
I was at the gas station. I was buying something at checkout. This guy robbed the store, man.
Robbed the store. Okay, yeah, I heard you were in a little bit of a scuffle. Did you
Yeah.
get hit?
Yeah, he punched me right in the chest.
Punch you right in the chest with what, his hand?
Yeah.
Okay. Can you just get a blood pressure for me when you get ready?
Blood pressure?
Blood pressure, pulse ox, and the 4 lead if you can do it for me.
Yeah.
Alright, so he punched you right in the chest. About how long ago was that?
About 10, 15 minutes. I just came straight here. I came home after.
Okay, so you drove home?
How'd you guys? No, I walked across. I was just buying something at the register.
Okay, so your main complaint today is your chest is hurting.
Yeah.
From the fight? All right.
It hurts when I breathe.
Okay, hurts on inspiration. When you
Yeah.
breathe in. All right. Do you have any allergies to medications?
All right. Allergic to morphine. That's
Allergic to
about it.
morphine. Okay.
That's all I know.
What's your history? Your medical history like? Do you have any respiratory problems? Problems with your heart?
Not really, man.
No, not that you're aware of. Are you diabetic?
No.
Okay. Any history of stroke, TIA?
Nah, I don't know.
Nothing?
What that is.
Fairly healthy for the most part?
Yeah.
Do you take any medications?
No, sir.
No, sir. All right. And you were just at the gas station. You said, and some guy attacked you.
Yeah, I was standing in line. He punched me right in the chest,
Okay.
man. It hurts.
Give me 1 second. All right. This is unit 103. Can we go ahead and get SO on scene? En route. All right. Well, since you're assaulted, we're gonna have the police department come and check you out. Okay, maybe get a report from you as well. But we're gonna take good care of you. He's getting a blood pressure right now. Let me go ahead and hook you up.
He's 172 over 102.
172 over 102. All right.
110 over 60.
110 over 60. Heard. All right. Well, your blood pressure's it's not critically low, but it's a little low. Okay. So what he's gonna do, he's gonna finish hooking you up. I'm gonna go ahead. Do you want to go to the hospital today? We advise you get checked out. Something like
Alright.
this happens.
That's why I called you guys.
Okay. Good deal. Then we'll transport. We're gonna get a couple things done first on scene,
Alright.
and then we're gonna take you down to the hospital. Okay. Thank you, sir. I'm gonna get this pulse ox on while we're doing that.
Oh, man.
If anything changes, you let me know. Okay.
It's just really hard to breathe.
Really hard to breathe. Where's the pulse ox plug in on this monitor? We don't have
Plug
it.
it in for you.
Thank you. Appreciate it. Okay, can I borrow your finger for me, sir? It's really hard to breathe. We're gonna get you on some oxygen here, all right?
Alright.
Do you ever have any problems breathing before?
Oh, man.
No? All right, just try and sit back and relax. Are you more comfortable sitting up?
I want to move, man.
All right, then perfect. Stay right there. Where's our nasal cannula?
Top.
Nasal cannula?
Yes.
Top?
Yep.
All right. You doing all right? Still hurting?
Yeah.
Okay. We're going to try and get you some oxygen here real quick. If we get you on the stretcher, you think you can take a couple steps with us?
I'll try.
All right, we're going to try and do that. You seem like you're getting a harder time breathing. 115, 119. All right, goes right in your nose. Climbing. All right. Once we get him on the stretcher and in the back, I'm going to get a 12 lead.
Your heart rate on your monitor is 130.
130. Heard. Thank you. Do we have a key for this?
So,
It's empty. We got him on 4 liters right now. Plug the capno in. All right, what we're going to do is we're going to take a couple steps to the stretcher, all right? I'm going to hold your arm. I'll assist you. Our stretcher's over here. What we want to do is when we get to the stretcher, you want to put your bottom right in the crease, okay? Get you sat up on there. All right, we'll go down on 3, okay?
Yep.
All right, 1, 2, 3. Up.
you don't walk it.
Yep, heard. All right. You want to grab the monitor for me?
Got it.
All right, sir. Try and slow down that breathing, okay? Can you get up for me? Try and take a few steps. We're going to go around the table this way. You're doing good. Turn towards me. Sit your bottom right. There you go. Can you swing those legs up? Perfect.
Rails up.
Yep, rails up. I'm going to strap him in a second. I'm going to sit you up. Can you get the monitor under there by any chance? We'll have oxygen on this one. Put that there. Sit you up, okay? Is that a little better? All right, we need to get him on non-breather. As soon as we get in the truck. There we go. You want to put this on face for me? All right, we're going to put him on 15 liters, non-breather. Get him in the back of the truck. We're just saying we get him in the back. I'd say we're in the back of the truck. We're not transporting just
Push
yet.
him against that wall.
Okay. Here, got your straps. I got one here. Strapped in. You're doing good. So we put him in the back of the ambulance. We're not transporting yet. I want to get an IV. If you
Push him
could,
against that wall if you want
Okay.
to stretch in the ambulance.
sure. Also, want to get another blood pressure. Run another set of vital signs.
I should bench.
Yep. Thank you.
One more blood pressure?
Yeah. Is he? All right. That's good. Go ahead. Do we have the arm for the IV?
You actually are on the outside of the ambulance right now.
Oh, okay. Sorry about that. I'll just put it. Yeah. Thank you, sir. All right. All right, hang in there. You're doing good. Okay. We're gonna give you an IV starter. Give you a little bit of medicine to help you with that breathing. I think we hooked it into the monitor. I don't know. Is it reading? Did we get a Capno? I hooked the monitor in. Did we get a Capno by chance?
Not working.
Not working. Understood. All right. Also, if you could listen to lung sounds for me and tell me what you hear, that'd be great.
Okay, sir, can you take a deep breath for me?
Clear.
You say clear on that side?
Distant.
Distant? Okay. Looking at his neck, does he have any JVD? Anything, any JVD on either side of his neck?
Yeah.
No?
He gave you the lung sounds?
He did. He said distant on this side and fine on that side.
Very good.
Sarah, you doing all right? Stay in there. Hang with us. We're gonna get you some medicine, okay? Hang in there. You getting the blood pressure?
Yep.
Do we have a normal heart rate, or do we have to monitor that as well? 1, 2, 3.
Still at 130 on the heart rate.
Okay, very good. He's attached and flushed. How's his breathing rates down to what rate? We don't have a lock on
26
this
and
one.
very shallow.
Very shallow. All right. Where is? This isn't a lock, but we'll say it's a lock. Do we have an IV lock by any
Yes, we
chance
do.
in here? This one's not a lock. It's just a.
Yep. Blood pressure 165 over.
All right. Is he breathing still?
Blood pressure 80
what's
over
his-
40.
All right. We need to get a secure airway. Yeah, we need an IV lock if you can get one.
Yes.
I'm gonna work on. Sir, take some deep breaths for us, okay? When you can, the stuff here to secure it is right here on his wrist. If you can finish up that IV for me.
I'll finish up IV.
Once you get that, I'm gonna draw up. He's gonna need it. What's his cap now? Is it still nothing? SpO2?
SpO2 is 89.
89? Alright. I'm gonna have to, I'm gonna, 8 times a minute?
26.
26 times a minute? Alright, we're gonna go ahead and, I'm gonna tube this guy because he's not breathing. IVs, are you working on the IV? I will get the drugs up.
Lock on there.
I'm gonna go ahead and give 10 milligrams of Versed, and then I'm gonna go ahead and get, how much our patient weighs?
What you see is what you have.
Okay, perfect. So we'll say he's 70 kilos. No, we'll say he's 80 kilos. So I'm gonna go ahead and give 30 of etomidate after I give the sucks. Or the Versed, sorry. Versed. Where is it? I know you're busy. Do you by chance know where the Versed is in the box? I'm looking for it.
Yes. You have.
You're doing good. Hang in there, okay? And I need draw needles as well. Those are all,
Yeah, they're all right down there.
okay. You're doing all right? I've got the atominate. All I need is the Versed. We're going to go ahead and start bagging this patient. While you look for that, I'm going to start the bag.
You walk on the outside of the ambulance
Oh,
again.
sorry about that. Coming behind you. Whoop. All right, so we're bagging this patient once every 5 to 6 seconds. The moment.
Midazolam's right here.
Bag 'em, bag 'em.
Okay. Oh,
You can actually hold it off the side of his mask.
okay. Well,
All
right, so we're bagging him. can you drop the drugs for me?
Yes, sir. How much?
Perfect. We're gonna go ahead and intubate. What did you say you had?
I got midazolam.
Midazolam. Go ahead and draw 10,
Ketamine right here.
10 milligrams. Oh, wait, ketamine.
Yeah.
So that's. Do you remember the dose for that?
Mm-hmm.
What's just
2 milligrams per kilogram.
okay? Draw up. He's 80 kilos, so 160 milligrams.
Okay. And midazolam, how much?
Midazolam. We're gonna go ahead and give him. He's 80 kilos, so we're gonna give. It's 0.3, so we'll give him 30.
30
milligrams. Sorry.
30 milligrams.
25.
Midazolam.
25. Is that? He's coding. Starting CPR. 3. Well, yeah. What's his recommended dose for the midazolam? It's one.
I would give him.
It's 0.3, right?
I would give him 5 milligrams.
All right. We'll give 5 milligrams after the first dose of the 100 and what did we say? 160 of ketamine. 160. Okay. So go ahead and do that. 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. My patient's still not breathing in apnea, or pulseless in apnea.
Assess
Yep.
the pulse. Do you want the pulse? Okay.
Pulse.
Pulse of about 150 but weak.
Okay. Stopping CPR, continue to bag. I thought the beeping was the heart rate. So 1 every 5 seconds.
Just put baby him off to the side.
What? Okay. Cool with that.
No, bag him off to the side of his face.
Oh, okay.
On his face.
Looking for an OPA. Where is? I'm looking for the.
Here's the Versa, 5 milligrams.
Thank you, sir. Do you have a flush in there by chance? All right. If you want to push it, I'm gonna try and insert OPA. The drug's right here for me. So I'm gonna attempt to put in an OPA. Rotating. Does he have a gag reflex? No gag reflex? Okay, OPA in. Gonna continue bagging.
Pushing 5 milligrams
Heard.
of Versa.
So we're bagging with an OPA in. He has no gag reflex, so I'm gonna go ahead and try and drop the tube. Put this to the. Do we have a mannequin for a tube?
Flushing it.
Thank you.
5 milligrams of Versa on board.
Roger that. Good. All right. At this time, if you could just reassess him or bag for me,
Bag, yep.
that'd be fantastic. He's got an OPA in. I'm gonna get ready to intubate. He's got all the drugs on board. Just make sure we stay on that bag because he's paralyzed now.
Really want a bag.
No, it's to the side, I guess,
Okay.
is what we're doing. Am I doing it on a mannequin? Obviously, I'm not going to tube him. Or we'll just say, dropping a tube. Dropping a 7 tube.
I can't find it.
Okay. dropping a 7 tube, inflating the cuff, listening to lung sounds on inspiration, listening over the epigastric, bottom left, bottom right, top left, top right. I'm also putting on capno, seeing if I have any, my reading on my capno.
Okay, capnography is showing respiration.
Okay, good. So,
The waveform, breath sounds are unchanged from how you had them earlier.
okay, so breath sounds are good. That means tube's in place. He's still distant on the left side.
Yeah.
Then we're gonna. I'm assuming that he has a pneumothorax, so we're gonna have to needle decompress.
You're in the right bag,
I am. Yeah, it's right here.
right in there.
So he's gonna continue to bag at that rate. We have any JVD, anything like that? Possibly left-sided.
Are you decompressing?
Yes, sir.
On the right side.
Right side JVD. Okay. Don't need that.
Yep.
That's too short. Thank you, sir. What the hell? I haven't played with this in a while. Continue to bag. Clean the site. We're gonna go above the third rib, under the second. So in the second intercostal space, 1, 2, right here, mid nipple line, cleansing the site. One, 2, right above the third rib. Needles in, pull the needle out, do I have sharps? Do I have any air, anything like that coming out of the site? Good.
What you hear is what you have.
Okay. So, nothing. Your bag. You have tape? You need a tape.
Yeah, there is tape. If it's not in there, it'll roll in the drug box, right side, halfway down.
Drug box, right side, halfway down. Heard. How's
No, in the actual box.
Okay, gotcha. Right side.
Keep going. Should be one in there.
There it is. Gotcha.
Got it?
Yep. Heard. Do we have a 3-way stopcock in there as well?
Yes, but that should be in.
Okay. Are we still getting good compliance on the bag?
That's your partner.
Are we still getting good compliance on the bag?
Yes. Much better.
That's improved.
Okay. So we're just putting a chevron in place to hold it. Well, sort of. So that's secure. Go ahead, 3-way stopcock.
No, it shouldn't be in there. It should
No?
be airway stuff.
Heard. Would it be in the RSI bag or the actual?
No. It should be in the intubation bag.
Heard.
It's on the outside of your ambulance.
Sorry. Mental thing. Woo, making a mess today. Crike, needles. I got nothing in here. Alright, well we're not gonna get caught up on that. Keep ventilating. We wanted to... How's his capno and his sats?
Good
And his lung?
waveform, saturation 93, and you're at time.
Okay.
All right. So what was your name?
John?
John.
Anderson?
Excellent. Thank you. Couple questions.
Yes, sir.
Do you think this is a pass or foul?
We never transported, so I think it's fail.
Okay. What was your diagnosis?
I think he had a pneumothorax on the right side from the chest trauma that he had gotten.
Excellent. Do you think this was a fair assessment?
Yes, sir.
Was this real life?
As far as the skills, obviously not because they're mannequins, but it was, the information and everything was very well brought out, so.
And Gary, right?
Yes.
Gary, how do you think was this real life?
Very much so.
Okay.
I thought so.
Was this a fair assessment?
I think it was a fair assessment.
Excellent. Thank you. Let's clean up.
Yep.
Let's prepare for the next one, and we'll head over. We'll head over now.
Good patient.
Debrief.
Yeah, I'm good. Thanks.
You all right? My bad.
And then we'll come get
Just get you unstrapped.
come get